I'm Ashley Gudgeon, the osteopath here at Absolute Health and Performance.
And I'm Ben Bond, the physiotherapist here at Absolute Health and Performance. A lot of the times when runners are treated, they're talked about in terms of their injury history a little bit and maybe treated inside the room, but then not necessarily going that next step and having a look at them functionally. So we think the multi-stage running assessment package that we have here encompasses how someone would normally be treated for a running injury in the rooms, but then adds that next level of assessment and treatment, looking at them functionally and seeing whether any contributing factors can be identified through assessing their running.
Yeah, so initially you'll fill out a pre-screening form and that will give us some information around age, your current running ability, so what kind of running you do at the moment and where you would like to get to with your running. We'll go through all of your injury history, so any injuries that you've had in the past, whether that be running related or just in general, we want to understand that. Then we will look at things like trying to understand how well you sleep and how stressed you are, because those two things will play a really big role in somebody's ability to recover. And then finally, it's understanding training loads. So what training loads are you currently doing, and could they potentially be contributing to why you're not improving or why you're currently injured?
So the musculoskeletal assessment is generally the second stage to our running assessment once we've gathered all that subjective data, and we've come up with a list of running specific measurements that we like to look at with someone that is either getting into some running or someone that has been running for a while, and they consist of flexibility, strength, balance and control. So running is quite a complex movement, and therefore there are certain measurements that we will look at in terms of flexibility, for example around the ankle and hip, that are quite important for running, and then we have some key measures around certain strength areas such as the calf and quadriceps, and around the hip as well, which are quite integral to running. And then we kind of progress things a little bit further and look at people in a little bit more of a dynamic fashion in terms of how their stability and control is with certain exercises such as jumping and hopping that then translate into running.
Yeah, so we get somebody down onto the floor and onto the treadmill, and we use slow motion video analysis to look at somebody running, and that will be from a posterior view and a lateral view as well. And we'll be looking at certain things throughout that running pattern, things like their ability to triple extend through their lower limbs, how well they can toe off, how well they can stabilise through their hip and pelvis, their dorsiflexion at mid stance, their strike, whether they're a rear foot striker or a forefoot striker, lots of different things like that make up their running mechanics and can contribute to their injury. Yeah, so we will do the filming there and then we'll come back up into the room and we'll use that slow motion and analyse it with them in the room. And then at the end of the 3 sessions, they'll get a report themselves, and we'll highlight some of the areas that we found and some of the areas that we've started to work on. So they'll get a visual feedback from like a picture point of view with some angles and some things that we are currently working on. But from every single session, they'll be looking at the video along with us to understand what we're currently looking at and working with.